Welcome to this Autism Ontario webinar, promoting mental health in autistic people and the importance of context and support. Today, in another one of our virtual sessions, I was just telling the folks at Autism, though, that we have our first people coming back in the studio, so we may be back on the desk sooner than later, but nonetheless, this has been a really fun and interesting experience. And coming back, we've got a gentleman who I interviewed almost a decade ago, Jonathan Weiss from York University. Jonathan, I can't believe it's been that long. Thanks so much for being with us. As always, before we get started, I got some stuff I got to cover, and that is this. If it's your first time with us, let me draw your attention to the Ask a Question box just below me. We've got over 500 people online with us today, and so we expect there's going to be a lot of questions, and not all questions I'll be able to get answered, but I'm going to try and get as many as possible. So submit your questions through the Ask Question box. They'll come to me, and I will aspire to get you responses from Jonathan. From time to time throughout the presentation, we're going to be referencing some of our resources, like stuff that's in this PowerPoint deck, or a great blog post that's jam-packed with stuff that Jonathan offered. And you can get those in the handout section at the bottom. I just popped them up for you there so that you can go ahead and download them as you see fit. And basically, if you have any issues with technology, click the help button and you will get the support that you're looking for. So without further ado, Jonathan, last time I interviewed you, again, I can't believe it's been almost a decade. You still got all your hair. I wasn't so lucky. Last time we talked, it was primarily focused around bullying within the autistic community. You had done a great amount of research. What have you been up to for the past decade?
Well, it's great to see you again, Matt. And I was looking forward to spending some time with you in face to face in person. And this is kind of the next best thing. A lot has happened since then, since that focus on bullying. I was always aspired to support people's mental health and their well-being, and bullying was a part of that. It was like a deep dive on one specific issue that I heard was really important for the autistic community. But since then, I've had a lot of opportunity to learn from autistic advisors, learn from family members, to learn from peers and colleagues, and take a big picture on what it means to promote mental health. So what I hope to talk to you about today is not focus on any one specific issue, but instead leave you and leave this great audience that we have with us with like some big picture ideas that I think some of them will apply to everybody who's listening.
Well, clearly I've got a bit of a sneak peek in all of this, and I know that I think it's going to be great for everyone, and they're in for a treat. A lot of what we've been talking about clearly since the outbreak of the big elephant in the room, COVID-19, has been that impact on whether it be people on the spectrum, mental health, and the like. But you're going to take a slightly different approach to this presentation today. Am I correct?
Yeah, when Autism Ontario approached me to pull this webinar together, believe it or not, it was before the pandemic. There was a time before COVID when we were focused on wellness and well-being and on improving the lives for people with autism and their families. And so when I had entered into that discussion, I thought to myself, how do I bridge that gap? We're already talking about a new normal. We're talking about beyond COVID. And I want us to think here today, learn lessons from what we're doing, but think about things to promote mental health now during this pandemic, but also beyond, right? And I've actually had a lot to learn. So, to the audience, if you're here thinking, COVID's causing us anxiety, I'm feeling so stressed out, I'm feeling a lot of distress, that's normal. We're all in these kinds of situations. This is the time. And I bet a lot of what I'll talk about will resonate with you for what helps you get by during this pandemic. And that's what's amazing about what I've been observing is that these same things we can learn to promote mental health in autistic people after.
Right. And, this is like last week or a couple of weeks ago, we did one about like for couples, parents and the sort of thing. And it was highly focused on COVID, but one of the things that I extracted out of that was all of this is, well, not all, but one of the things this is doing is it's just giving us a focal point around some of these things that were already there. And it's not like since COVID came out, you guys, all the psychiatric community and the medical community has changed everything. You're applying what, the evidence that you've kind of got into. So May I hand it over to you. What are we talking
Sure.
about today? What are we going to be going through today?
So in thinking about 500 people, we've got family members, we've got autistic adults, we've got professionals. How am I going to pull together something that's going to resonate and leave some take-home messages with everyone? I'll talk very briefly about rates of mental health difficulties and what we know around mental health for adults here in Ontario, and some research that I've done with some peers. But then I want to spend the focus of our time talking about positive mental health, about promoting positive experiences that can help us cope with stressful times like COVID. And more specifically, if I'm already giving away a take home, a focus on the importance of intervening with peers, intervening and supporting with families, and most probably importantly, intervening and focusing on contexts, on recreational access. Believe it or not, I'll talk about interventions that are really about recreation and leisure and the importance of that for promoting mental health, as well as thinking about post-secondary opportunities. So that's going to be the focus of what we talk about. And if we have time, maybe a video near the end.
So some of your language was interesting there, and I'm wondering if that's going to be a precursor to what we're going to see. I didn't hear the word mental health issues, and terms like wellness and going beyond. I assume that was done very much on purpose.
Well, that's exactly right. So I brought up our next slide here because I want people to have a takeaway. I bet a lot of people, when they were first thinking about registering for this, were thinking, when you think mental health, when I ask you, Matt, what does mental health mean to you, right? If you were to describe your mental health right now, would you use words like anxiety, depression, anger, maybe, or I'm mentally healthy because I'm not experiencing a lot of anxiety? Sure.
It's one or the other, right? It's one or the other. Right. Whether I would either say I have a lot of anxiety or I'm feeling good because I don't have depression, anxiety, like these two or three, the big ones that kind of pop up.
Of course. But what we also know about mental health is that it's not just the absence of the negative. And that's why this isn't really just about mental illness or mental health problems or mental health issues. But really, if we're going to think about promoting mental health, we have to think about the positive. And this kind of slide highlights a technical definition of that. There's really positive and negative states to mental health, including our capacity to enjoy life and deal with the challenges we face. That's a very empowering approach to doing so. And the importance of this is that the literature is almost full. It almost is completely full of the focusing on the negative. And you know that expression, if all you have is a hammer, then everything's a nail. We really need to be able to take a step back away from that and empower us to have different tools for different kinds of solutions, right? The absence of a mental health problem is not the same thing as good mental health. So we need to have different words. And an important one that I want to share with people next is thriving. And for me, if I were to ask somebody about what's successful living for you, it wouldn't just be about a lack of anxiety. It would be about living with probably both anxiety and those difficulties, as well as the positive experiences. And the interventions I'm going to talk about today are things that can help with both of those. And this is what I mean by that. So what are some positive kind of constructs or positive terms that can balance out some of those negatives that are important to talk about? And again, I'm not trying to get rid of the negatives. I'm just trying to balance them. And I've been very interested, and my research has focused on thriving with autism. So instead of just addressing anxiety and those things, how do we promote competence? So the experience of I can do it, confidence, I believe I can do it, right? Caring and connectedness being this experience of belonging in a group, feeling like you matter, right? Caring, experiencing and demonstrating sympathy and empathy for others and being cared for. Character, knowing right from wrong, or having a moral sense. And we know many autistic people have very strong character. They have a very powerful sense of right and wrong, a moral experience, and being able to contribute to yourself, to others, to your family, to society more broadly. You see how these constructs are different than just let's reduce anxiety. If we can focus
on Jonathan, I'm sorry, just looking at it myself, it's like, as a father of a neurotypical son or to believe he is. I mean, this is what you want for anyone, right? This is what you want for yourself. Is the concentric circle diagram that we see, is this something that you composed here, or is this taken from just, general ideas of what we all need to thrive in this world?
So as a researcher and as a scientist practitioner, I really like to found my slides in science, and this has been studied in the typical positive youth development literature. There's a universality to this, and that's what's a good takeaway from this, is that while we're talking specifically about autism here, so much of what we're talking about here is good for everyone. And a lot of this is moving beyond autism to considering disability and difference and a broader society. That's right. But if we did zoom in on autism for a second, as a psychologist, one of the things I have to do is present at least one percentage point somewhere in a presentation, or I lose my license. So, So here's the one that I want to convey. The story is this: when people are looking at this graph, and this is the only graph I'm going to show in the whole thing. Mental health is an important topic for all adolescents and adults. When we did a study with colleagues with healthcare access with developmental disability age card, what you're looking at here is all the young adults in Ontario who have an identification in administrative data sets, or like your OHIP kind of designations, have a label somewhere with autism in it, or developmental disabilities, or without those. And if we looked at the general population who don't have any kind of developmental disability in Ontario, of young adults like 18 to 24, 1 in 5 young adults have at least one psychiatric diagnosis in their health records somewhere, in their administrative records somewhere, right? So mental health is an important topic for everybody. It's higher for people with developmental disabilities, even without autism. So if you have Down syndrome or Fragile X syndrome or other kind of developmental disability, about 38% of young adults have at least one psychiatric diagnosis in their file. And that goes up to about half for young adults on the spectrum. So mental health is an important topic for autism to talk about. It's a critical topic for disability, and it's an important topic more generally. And that's, to your point, why this is so important to consider autism-specific lenses, but also a more universal lens. And why are rates so high in autism? Well, this is my first kind of takeaway, or maybe it's the second for some people already, is we have to move beyond the individual if we want to answer the question, why are rates so high? What a lot of people talk about is that people with autism are going through their lives experiencing what I like to call, and other people have called, autism-related stressors. It's not the autism itself that's causing the problem. It's the stresses within their contexts, because they're growing up or they're living in a non-autistic world, or a world that's not designed and fitted well. The goodness of fit isn't there around autism. So here I've put up on the slide very common stressors that many youth and adults experience. Being overloaded by social situations, for example, something they have to deal with on a day in and day out basis, or bullying and rejection, the things we studied 10 years ago, right? That's another kind of instance. Or not being able to engage with and focus on things that we're interested in, or being punished for the things we're interested in, right? And the list can go on. And when you're looking at these kind of ones here, Matt, what you can really see are the vast majority of these things are outside of the person. Yeah. It's not the actual person that's causing, but if you had all of these that you're seeing here every day, and you were experiencing all of these almost in your entire life, do you think you would feel probably more anxious and more distressed? Yeah, right? So there's no wonder that rates are so high when people are dealing with some acute traumas, and also more generally, things that chip away and take away from our emotional well-being. So this already speaks to the importance of figuring out, how can we change not the person, but how can we help them cope with these stressors, but also how do we reduce these stressors?
Yeah, and so I've heard some of the stats. I mean, they've come up many times, like on the desk. But one thing that I'm just curious in seeing that is anxiety the number one sort of, like, when I see all of this, that's the first thing that sort of I think, is that the number one sort of, call it comorbidity or mental health concern within the community of autism? Yeah.
Yeah, so in terms of if we were to put numbers to them, the numbers move depending on the study. But as an umbrella umbrella term of anxiety disorders or anxiety problems. That's the most prevailing. And another very important one to talk about when it comes to especially adolescents and adults is depression and suicidality. So while anxiety seems to be consistent and emerge a lot earlier, depression and anxiety are also very common. And the real important takeaway is that almost for every single one of the mental health disorders that we could talk about today, there are higher rates for people with autism than in the general population. Okay. So let's go back to COVID for a second. And again, I'm not going to talk specifically about anxiety or depression, because when it comes to those things, they actually go hand in hand. It's not like people with high anxiety have no depression. You know, the more anxious we feel, the more likely we're also going to feel these other, they're related to each other. So I talk about more distress and mental distress. But if I were to ask people to think for themselves on the webinar right now, think about how you're doing and how you've been doing since COVID and since all of these changes happened since COVID. Would you rate your distress and your stress levels lower now since COVID or higher, right? Or more elevated since COVID? I think many people would say they're higher right now, or in my autistic child, it's higher right now, right? Whether it looks like sadness or anxiety or depression, that can vary. And there's lots of reasons in talking with people. Maybe there's been a loss of supports, a disruption in routine, maybe accessing resources or communication tools that were so important before aren't there now. And the list could go on in terms of the kind of stressors that are new because of COVID. At the same time, I've also heard from many families and autistic people that they're experiencing less distress now during COVID than before.
Really?
Because what was causing them stress was having to go to school, having to interact outside of a community that understood them and supported them and embraced them for who they were. But instead, all of those stressors, the autism-related stressors, now they're not being confronted with them to the same extent.
Right?
So, and the stress that they experience now is this discussion that we're having about, that you started today's webinar with going back into the office, going back into, now that we start thinking about this, we see stress rising. And this really speaks to the importance of context, right? If by the virtue of COVID alone, some people's distress goes up and other people's go down, it really shows us that distress and mental health are beyond the person, and we need to focus on the person and their context together. And this is, there's a very simple model that can become very complex quickly that's going to drive this kind of point home for people. If we wanted to improve thriving in people, let's say, right, we wanted to improve their ability to have the competence and the confidence and the connectedness and all of those things that speak to those positive elements. One of the things we have to know is, what are their strengths? What things do they bring? You know, I might bring certain strengths in some domains that are going to be very different than somebody else's. So understanding what a person's relative strengths are is important to recognize. And it doesn't mean, you know, special abilities. It just means what works for them best, right? And where are their difficulties? And we have to understand the person. But then we have to think about the fit with their environments. So an environment that's going to work well for me is going to be different than what's going to work well for you, depending on your strengths and your needs. And we can think about school as a perfect example of this, right? Or work, or the family, or outside in recreation. So finding that fit with one's ability, and the better the fit or the better the alignment, the more thriving we tend to see. But an important kind of caveat here is that no one size fits all. There's no way I could be on this webinar and talk about specific examples of the program or the intervention or the change that's going to work for any two people on here, because everybody's different in terms of their circumstances and their strengths and their needs. So I'm going to take a zoom out and talk about the importance of promoting family wellness, promoting peer connectedness, and most importantly, about recreation, leisure, and community access to driving this kind of mental health agenda that we've been talking about, and then give a really, really concrete example of people who are doing this from Australia, specific to autistic teens in a school environment. But I think it's really going to drive home the point about how can we actually intervene in a way where we support the individual and the broader context. Does that sound fair?
Sounds good. But before you get there, I got a couple questions from our audience that I thought would also be, they're really good setting it up questions. First off, this person wants to thank you for what's already been a highly informative presentation, and we're just getting started, everyone. I'm wondering whether asking to, it says tease apart, I think it's take apart, what is the autism affecting and what is the mental health reasonable or doable? Like, is that something that in your practice or when you're dealing with people is even possible to do?
So they're sometimes very related to each other, and they're sometimes distinct. So we often talk about that the mental health difficulties are associated with experiencing autism, but they're not the same thing. We know that people can have lots of signs of autism, right? They can be autistic and not have high levels of anxiety per se, right? So they're not, just because one has autism doesn't mean one is also going to have anxiety. So we can tease them apart. An important way of teasing apart differences is to ask, what's that person's typical like? Before, if there are concerns that we have around anxiety or stress or behaviors that we're concerned about, one kind of telltale way of understanding, is it part of the person and who they are, or is this something in addition to who they are or separate from, is to ask, to have a good sense of what their baseline is. What's their typical, their usual, right? If I'm working with somebody, I know somebody, I'm caring for somebody who part of their routine is they have to open and close windows in a certain way, in a certain pattern, to feel comfortable and to feel kind of usual. They might not have any words to express this, but I just know them and I know their usual. Okay, here they go. They have to open and close every single window on this floor, and then they're going to feel okay. Well, that's not a mental health problem. If I get in the way of them and I block them and then they feel stressed out, that's not a mental health problem. That's a problem with me getting in the way of their needs here. Okay, so right? That's. But let me just say, Matt, if for example, I walk in and now that person has changed their behaviors. They're no longer opening and closing those windows in the same way, right? Now that looks different to me. Then I start to think to myself, there's a change from their usual. Is there something in addition to autism?
Right. To a neophyte like myself, I hear the opening and closing of windows in a certain way, and that seems to demonstrate to me as typical OCD behavior. So the question that I would have for you is, and for those hopefully coming out on the line here, is do anxiety? It would seem to me, if that's the case, that it's not generally the same indicators when you're looking at anxiety or depression within the autistic community. There's some uniqueness there to even the diagnoses of some of these mental health difficulties, as you put on the first slide.
Right. It's really important that we don't overly pathologize and say a person has OCD when they don't, and it's autism that we're seeing. Right. And so, for example, in your example there, is it the question I would ask is it engaging with having to open and close the windows that causes the distress, or is it being prevented from doing so that causes the distress? In people who have obsessive compulsive disorder, not autism, for example, having to engage in those compulsions often causes them a lot of distress. Whereas in autism, it's being prevented from doing so.
Right, it's the opposite.
So you can have autism and obsessive compulsive. You can have both of those. Right. But it's really important that, and this is why it's really important to understand what that person's usual is and understand mental health problems in relation to changes from that. Their usual, not my usual, not what we expect, right? So you have to really know the person well.
And let you move on right after this. We have a couple more questions that I think will be better to come up later. So don't worry if I don't get to your question. But before we do, the crux of that first question that we had there that we bantered about here is it possible to tease apart? And what I'm hearing from you, I think, is that not only is it possible, it's almost necessary, right, in the treatment process to do that. Like, you want to do that so that you are working with, on the autism on one side, skill-based or whatever it might be, and then dealing with anxiety. Let's just use it as our example on the other side. It's important, right? In your practice, you feel to do that.
Yeah, I think it's very important to be informed about what autism looks like and that person's autism, and also the mental health aspects separately, because it
Yeah.
can involve very different treatment options, different approaches. And while they might be related, if we overshadow by saying it's all anxiety, or we overshadow by saying, nope, it's all autism, then we're missing a really critical aspect of that person's experience and how we're going to actually help them best. So I do
Okay.
think, and it is, and I will say, to answer your question, it is possible to do so, to distinguish. It might not be always easy. It might take
Right.
time, but it's
Yeah.
possible.
Well, you didn't get into this profession because it was easy. All right. I'm going to give you some time. Let's move on to
Sure.
supporting families and our normal agenda here.
That's great. And one thing is that I know if there's not a lot of time to talk about questions that come up, if there are frequent questions that are coming up afterwards, when I produce I'll create a blog post that I'll be able to kind of answer in an FAQ, some of the very common ones for everyone. So let me talk about families, peers, and community for a second. So one important component is that, families, again, this is not specific to autism. Family wellness, family warmth, family connectedness, and cohesiveness is an important driver of mental health. The healthy families and healthy individuals are related, right? There's an interdependence there. So in my practice and in our research, we do a lot on focusing, how do we promote family wellness beyond the individual? And we know that there's a few kind of major take homes around this that I want to share. The first is there's a very simplified model of what keeps a family working well. It doesn't mean perfect. There's no perfect family, but managing the stressors that come and being able to show, and there is research to show that families who have more warmth, that's actually a buffer to the stressors in the lives of autistic people. So having warmer families and connected families is an intervention in and of itself, even if you never actually see the person with autism or work directly with the person. And there's three things that are really important to this in general. One is to have a sense of the balance between the resources that a family has and the demands that are placed on that family. Sometimes, like when COVID hit, everybody's demands, or most people's demands, increased, right? So you can
Right.
imagine the teeter-totter kind of going up here. It becomes imbalanced. And then what do? We all tried to figure out routines and changes to add to the other side, either to balance it out by adding more resources or removing some of those demands, didn't we? And it's never a perfect balance, but this is really important when people are striving, when there are changes and stressors in our lives, to be able to ask the question, do I need to remove some demands from this equation? Or do I need to bring in some new resources, some new coping, some new strategies that we haven't done yet? A lot of times what I see in autism when I'm working with people is people are really focused on adding something new. Let me bring in a new intervention. Let me do something. Let's add something to the equation. And that's important. But often I think to myself, well, hold on, let's pause and say, maybe this is a time where we need to take a step back and remove something to get back to this balance. And the other thing that's important is that two families might have the exact same, it's not really exactly the same, but the same degree of resources and the same degree of demands, but have different experiences. Right? And that's because the stories we tell ourselves, our narrative, the meaning we make of our experience, we're all going through COVID, but
Yeah.
people's experience and understanding of COVID are different. So the
Right.
situations matter, but also how we see those situations matter. And so any intervention that's worth its salt, that's working with families, needs to be able to figure out, are we working to improve the capabilities of the family, address the demands, or change the meaning that goes into these? And there's lots of strategies for any of these. Just some examples of that. Right. So there's lots of evidence out there there's growing evidence for specific interventions, a lot of evidence for a whole kind of umbrella of mindfulness-based and acceptance-based interventions that are not directly focused on the autistic person, but on their family, whether it's sibling carers or parent carers. Acceptance and commitment therapy is one good example of that. mindfulness-based stress reduction is another one, or mindful parenting. And we've done some work with the South Asian Autism Awareness Center here in the GTA, as well as other people have done work looking at peer-to-peer ones. You might not need, and I might be, talking myself out of a job as a professional, but you might not actually need a therapist, a trained professional to be the facilitator, to be the deliverer. There's good evidence that facilitators provided alongside with peers, with other families, and this speaks to that connectedness. Delivering these kinds of supports is really important. What do all these things have in common? They're all about changing our meaning, figuring out ways of adding small new resources, and understanding how we can adjust those demands that were being placed upon us. And the result of this is more warmth and more connectedness, more resilience in the family, and that helps to promote mental health for the autistic person.
And if I might just interject for a moment there, if you go to connect with us online at Autism Ontario, what you're going to find is a lot of the past webinars. And I think it was the last webinar that we did, or maybe it was one before that. We talked a lot about the parents side of this and got real deep into what could be causing stressors, anxieties, and, challenges in the family dynamic during COVID. And it goes really deep into not only some of these evidence-based ideas, but, some books and some things that, are really, really helpful and very, very insightful. Because if, as parents, we're not in a good place as a result of all of these other factors, our work changes, this, that, and the other, it's going to be hard for us to do any of the interventions that we, are planning on doing, or any of the things that we're doing with our children. So it's a great one, and you can go to autismontario.com to check that out.
And just remember, there's a reason why when we get on airplanes, or when we used to get on airplanes, people would talk about putting the mask on yourself first before putting the mask on somebody else. Right? That when we take care of ourselves, and we're better able to care for others. And so, and there's data to show that that we, even indirectly, that the family is a buffer to those stressors that we talked about at the beginning of the webinar. That these are by taking care of ourselves, it is actually a mental health solution. It's not the only solution, but it's an important part of this bigger equation.
Right.
Now, if I want to move on from families now, I want to talk about the demands in kind of work and the stressors in work and in school settings that are so related to mental health. So people have done research in academic environments, especially, but I think it really is telling when they go and they interview autistic high school students, and they do reviews of this where they kind of ask about what the greatest concerns are in high school or in post-secondary settings. Turns out that it's not what a lot of people might think, which is the academics, the getting the A or doing the test. The big stressors are kind of social ones, things we can see here, things like the problematic social interactions that they have with their peers, a negative comparison. So being able to looking at your peer group in that school or in that classroom and feeling like you're less than because you're different. The unpredictability or the lack of control that comes from being in these kinds of environments, and the lack of fit, having to do things and be in classes that don't inspire you, that aren't interesting to you, that don't drive you, that kind of you're just being forced to do, or situations where you need a quiet space and the place is being very loud, it's affecting your sensory sensitivities. Do you see what I mean by it's not the academics, it's not the task demands that come with the job that are themselves the most stressful aspects that drive mental health difficulties. It's all of these other aspects of the settings of the context, and these are things that we can address. Right? So it's not one person who can address them or one solution, but here's a whole bunch of examples that people have put out in terms of being able to help improve those kinds of settings, and by virtue of doing so, improve or promote better mental health. Things like establishing quiet spaces or specialized orientations, making sure that peers and teachers, that managers receive training so they can be informed about autism, right? That they have a sense more generally about it and they don't pathologize or stigmatize a student or a colleague with autism. Being able to allow some choice, being able to allow supports and make sure there are those accesses to supports like alternative communication supports so people can get their needs met and also get their job done in a way that works for them. And ensuring that there's an individualized approach to accommodation, not a label-based approach where just because a person has the label autism, they must get a social skills group, for example. It shouldn't be this kind of, because of a label, this is what you get. It should be a discussion with the person to figure out what's important to them. Imagine if, and this happens a lot in our systems, but imagine if it happened more. And in those places where it's not happening, if we brought these kinds of changes in, these are mental health interventions.
I'm interested. We were talking a lot about how the world has changed professionally, and that this type of interaction is, I mean, it was always here, and, a lot of companies have been, working from home already, but it's going to become more and more and more as we saw the efficiency or the effectiveness of it, and as tools improve. Have you seen a negative, I don't want to take it all back to COVID, but have you seen a negative, a general positive as it relates to those on the spectrum and the way school is being delivered now, the way that work is happening? Generally speaking, is this actually better for them, for the people that you're speaking with?
So I haven't seen any data come out yet to speak to that one way or the other. And I know there's there's a number of different research groups who are actually studying the impact of COVID, but certainly people that I've spoken to, so this is just anecdotally, but people I've spoken to and speaking with professionals, mental health clinicians that are supporting autistic youth, a lot of them have said that many of those people that they were supporting pre-COVID with the anxiety, they expected higher rates now, and that's not happening. Because, again, back to that kind of fit, the stressors that were happening in that person's lives aren't there. There are other people now that are experiencing more anxiety. So for some, this change has been better, but for others, it's been worse, right? And so, and it's changes too. At the beginning of COVID, 8 weeks ago, 10 weeks ago, we're all at different places than we are now.
Yeah.
Some of us,
we had no idea.
Right? Some of us are more exhausted now, right? Some of us have found a place of balance or have adjusted to a new routine. Some of us have been feeling okay all the way along, right? So some of us were in crisis and are no longer in crisis. So we, in our understanding collectively as a society and then individually, are probably not at the same places, even within this experience. So it changes over time. And I think we'll know more as research comes out. But I suspect that for some, if you really need access to these things and you get meaning from your job and meaning with interactions with your peers, and that's been taken away, you're probably looking forward to getting back to that. So I wouldn't say it's a one size kind of approach around autism.
Never is with autism, isn't it?
Exactly.
Since I disrupted your flow and we got on to COVID, we got a couple quick ones here that we'll get to. For those of you online, I think the last studio event we did, I believe it's been posted. We talked a lot about the workplace stuff, and we talked a lot about the legality of it, but also some great examples of what's been going on out there. So maybe a quick one, maybe not. We have someone who's having some challenges with their teen, who's on the spectrum, using masks. And even feeling safe, like putting the mask on and feeling safe to go out again. So clearly they're aware of what's going on. Do you have any suggestions to deal with that specific issue without knowing more?
Sure. So that's a really interesting point around kind of what the mask signifies, right? So sometimes masks we think of as safety, but it can also represent danger. Right? It can represent a threat. This is different. It could also be very uncomfortable for a person to wear and have a sensory component. So there's lots of reasons why. But an important part of when I've talked with families is how we talk about COVID and what kind of messaging there is in the media that our youth, that our kids are receiving, are getting exposed to, the frequency of that, right? Especially around social media now. So that threat response can be very high in some people because we're being inundated 24/7 with messages of harm. And so one
Right.
important point is to figure out, what do we really need to say here about COVID and how safe things are in our community? How do we communicate that in a way? And a lot of autistic-led organizations and other organizations have created different ways of talking about COVID, generated by autistic people for autistic people. And so how do we talk about it in a way that empowers people to feel more safe? So part of that
Right.
is going to be is about reframing it. And another aspect is, how gradual can we be with going back out into the community, right? I was even thinking to myself, oh, I'm glad that we're doing this webinar this way, because if I actually got in my car and drove to this other office space, I would be put off kilter. I would feel more stressed out because I'm not used to that anymore. And there's more
Right.
uncertainty out there than there is here. But I
Yeah.
feel more comfortable being and staying in my own community, or walking
Right.
around my outside of my home, or
Right.
around my block. So to
Yeah.
consider kind of realms of exposure, rather than we're going out or we're not, right? Start with where we do feel comfortable, and then take a few, metaphorical next steps from
Right.
that,
Yeah.
right? And be gradual with that approach of getting out there. Does that help, Matt? To kind
That's
of
very true. I mean, and that's so resonating that you said that, because on Monday I went into the office. We are essential service, and we had some things. My CEO was back from Florida, and we were in doing things. And I've been very comfortable in Hamilton in my community, and I only go to a few places. I'm not out all the time, but I've been comfortable. I haven't been, but yeah, going out to Mississauga, I was looking at people in a different way, and my anxiety, I think, was higher than it has been throughout this whole sort of pandemic when I have been, sort of leaving the house. Another quick one, we'll move on with the agenda. Someone has been experiencing a lot of disruption in sleep since this started. Does that say they're waking up a lot, that kind of thing? Does that tell you, I know it's not, you can't diagnose or anything like that, but is that common? Is that a common predictor of anxiety? What do you feel when you hear that from our viewer?
So of course, there's so many reasons why a person can have disrupted sleep, everywhere from our sleep routines are messed up, our diet has changed, right, to anxiety that's staying with us, and the uncertainties of what the next day is going to hold, so our mind doesn't shift over, to feeling depressed, right, are all in potential reasons why somebody would have disrupted sleep. But it's very common, actually, right now. You're not alone. During this pandemic time, one of the biggest changes that people are discussing generally is disturbed sleep, in addition
Right.
to anxiety. So that is a very common thing that many people are going through. So it, as a starting point, whenever I talk about sleep issues, I often go and changes in sleep. And that's a good example of understanding a person's usual, isn't it? Because we all have
Right.
different sleep patterns. Um,
Yeah.
it's very helpful to go back to at least start by saying, how is my sleep routine different than it usually is before these things were happening? Right. Start with that. Often by changing that up and tweaking our sleep hygiene, that's what sleep hygiene is called, we can get back to that healthier place, and healthier sleep. But again, another aspect is that there is some embracing the suck here, so to speak. I've heard that's one of my kind of autistic clients kind of uses that term a lot, embracing the suck, where
Yeah.
we're gonna be, our sleep is a good example of something that might not be as healthy as it usually is,
Right.
and because we don't have the same routine as we usually do.
Right. Okay. Let's move on to
Okay.
the agenda here, because we've
So
got
let's,
just time check for you. We got just over 15 minutes and about
great,
20, I think
perfect.
about 20 minutes ago.
This is great. So I'm going to zoom over a few slides here, and then I want to get to that example of the individual, family, school kind of environment to drive home this point. But a really powerful ingredient to promoting positive mental health is connectedness. And it doesn't mean being the most popular person in your environment. It doesn't mean being friends with everybody, but it does mean that for you, there's some, either in person or online, some aspect of community that you're connected to, that you belong with. Most importantly, so for some, it might be being connected with a self-advocacy group, right? Or being involved in mentorship programs at York University, at other universities. There are autism mentorship programs that exist for students in those universities and those colleges, where people can be connected with their peers. These also exist in the community more broadly. So figuring out communities that we can be connected to. The most powerful ingredient or aspect of this for resilience is the message that you matter. It doesn't matter what organization it is, or even if it's informal, it doesn't have to be a formal organization. Some connectedness if it translates into that message that you matter as an individual, to me or to us, that's a powerful ingredient to resilience, especially in times of uncertainty and COVID. That's absolutely critical. And we know that it's important for autistic people, just like it is for people without autism. Some examples beyond those kinds of formal interventions per se. I do a lot of work with Special Olympics, which is a sport organization for people with intellectual disability, for youth and for adults. That's a prime example, this athletic organization, this athlete kind of sport-focused organization that enhances connectedness for people. And when we do our research, we give people cameras and we say, go out into the community and take pictures in Special Olympics of what matters to you. The number one theme that comes back in those pictures is about being connected with their peers and with their coaches. So enhancing connectedness is an important ingredient. Maybe for others, it's something specific to their kind of training. They're, going to a job placement that matters to them, that they feel like they belong to. So these are actual powerful mental health interventions. The other thing that I'll say is that beyond work or school, recreation is a buffer for all these stressors we're talking about for quality of life in autistic adults. So when autistic adults have access to recreation, so leisure activities, and that is therapy in and of itself for reductions in anxiety, for improvements in well-being. And we don't think of it often as interventions, but one of the most powerful things we can do is help enable people to access fun in their communities, things that are fun for them. And now, this doesn't mean that individual interventions aren't at all useful and we have to just get rid of them altogether, I believe. I think that there are supports for the person, but also these kinds of accesses for the environment that are really important. But any support that's focused on the individual the message can't be about changing who the person is. It needs to be about empowering that person to cope with those stressors that are inevitable in their lives in healthy ways, or help them to adjust those stressors that are in their lives. It doesn't matter what kind, about enhancing that goodness of fit that we were talking about. Right. Now, there's a wonderful quote that an autistic comedian, that Michael McCreary once said to me. And if you're interested in some of Michael's stuff, he's come out with a fantastic book recently, and we had him on a TED conference that we ran at York, and the link is there below. So he said, if you're in love with something, and you can see here, and you're intensely involved in it, don't let people take that away from you. If you have one dream, if there's something that you adore, you should have that your entire life, right? So we have to be very careful. One of the important messages here for him, it's comedy. And I would never say comedy is an intervention for everybody, but I'm always very sensitive to what's the important thing for you? What can I help you enhance? And I don't want to have to change that from you. I want to be able to help you work with that and thrive with it. Does that make sense?
Yeah, totally. And I mean, you see this with all children, right? In the way that even the school boards have started trying to base curriculum around the interests of the children in the classes and that kind of thing, is that it's, people are more interested when they have those things going on. And so, again, everything that's usually generally good for the general population is also good with autism. But I also imagine you put that up because, there's a lot of don't be doing only this, right? Because of the fixation, right. There's a lot of interventions that are trying to get them away from that computer or that whatever it is, that thing that they're doing, right?
That's exactly why I put it up, is that while the traditional approach to individual interventions has very much been this kind of focus on changing, becoming, less like or reducing and a deficit focused. And what I've learned is that we don't need to do that in our approach, that we can embrace the person for who they are and still empower them to cope with those stressors. So what I'm showing here on this slide, I'm not going to go through all these interventions, but there are traditional therapies that are effective. That is, they've shown that if people, autistic teens and adults, participate in cognitive behavior therapy, which is CBT, or mindfulness-based approaches, which is like MBSR, mindfulness-based stress reduction, or other kinds of talk therapies like non-directive counseling, that they experience as a whole, as a group, many people report improvements, right? So they change, they benefit. We could have a whole webinar just on any one of these kinds of approaches. But no matter which one of these things in red that you see, you know what the really powerful thing is? It's that there's the same effects regardless of what people are participating in. So the same percentage of people experience reductions in anxiety if they're participating in teens, if they participate in group cognitive behavior therapy or a group social recreation program. Right?
Okay.
So a fantastic, well-structured video game pizza night is just as effective as a whole as group psychotherapy is.
Right.
Now, does that mean that it's not at all, that one's not effective and the other one is? No. What it means is that not everybody improves in any of these.
Mm-hmm.
But some people benefit from one and some people benefit from another. Right? So there's a lot of help out there. Now, these are all short-term changes. We don't know that much about long-term kind of changes, but this has to let us think, let's not throw it all out. This has to lead us to think, well, why? Why are there similar benefits across all of these interventions? And I believe it's because of the support that these things all provide. And this is why the title today is about context and support. So there are these common therapeutic factors, I think, that are important for all interventions that are focused on the person. The facilitators have to be autism informed. They have to understand autism. They have to be able to empathize and put themselves in that person's shoes, right? To really kind of appreciate that person. They need to individualize what they are. Even just because a person has a diagnosis of autism doesn't mean I'm going to treat two clients the same way. I have to know their autism, right, to be able to make a good fit. I have to be able to inspire hope and that these people belong. And we have to be on the same agenda, right? So these are these common supportive factors that are important for everybody. So regardless of the intervention, if these are there, I think we start to see, for some people, a benefit. So it speaks to the importance of having like a menu of options rather than any individual one approach being the answer. Here's a good example. Go ahead, Matt.
I was going to say, and we see this sometimes with parents, or I've seen it in my personal life. They have a focus on one intervention, and that's going to be the answer to everything. So what I hear from that is like a John Krasinski, some good news story is that, you know, we also know that there's only so many therapists and professionals out there like yourself that are autism informed, or to a certain extent, and so just finding, whether it be that recreation or that, you know, that type of therapy is generally better than not, if you can find that. I think that's good news, especially in the self-directed initiatives that are going on in this province and in the country. So it was a bit of an eye-opener for me.
That's right. You know, we've done some work at York where we brought in this mindfulness-based intervention called My Mind, where autistic teens and young adults came in and they went to participate with their peers in one room, and their parents came in and they went to participate with other parents in another room. So and the parent group wasn't, let me tell you what you should do with your teenager. It was, no, you're here to get mindfulness for yourself. This is your time. So we were treating the parent, and we were providing supports to the teen or the young adult. And overall, we saw some nice improvements. And what do we teach? Things like being aware in the present moment, not judging ourselves and being hard on ourselves, being able to address our attention and focus on things that are helpful to us and that enrich us. And teens really kind of talked about that benefit. And I have a video. I'm not going to show it now because of timing, but teens really talked about how this was useful to them. So did parents. But one young adult specifically, I'll never forget, in his feedback form said to us, I would like it expressly known that none of the mindfulness activities were why I feel better now than I did before. Right? For him, it was being connected to and having a group of like-minded autistic peers for him to do something with that he had
Yeah.
never experienced before, that he was isolated from. Right. So we created the facility, we created the structure for that to happen. But he
Yeah.
wanted us to know that no amount of mindfulness practice in itself was why he was feeling so much better about his life. Right.
Wow. That's
So,
incredible.
so I think that's an important kind of telling message. Whereas for others, it was the breathing space, it was the meditation that was really useful. So think
Mhm.
about supports, kind of broadly speaking. Moving on from that. There we go. So this is that last example. This is what I wanted to end us with, Matt, which is
Okay.
this good example from Australia that they provided this concept of how are we going to improve the person and the environment. Let me stop there just to check in with you. Any pressing questions that we need to get to, that we should get to before I kind of jump into this
No,
last bit?
let's go through this. I do have a few questions I'm going to want to do at the end. And folks, just so you know, we're not bound by, we're not going to turn into, our carriage is going to turn back into pumpkins or whatever at one. We might go a little long, but let's get through this. I got 2 or 3 questions before we
Great.
close it out.
Fantastic. So this is the idea behind a whole approach to mental health treatment. So what this group did from Australia is they said, let's improve autistic high school students' mental health by doing 3 things. We're going to provide individual teen interventions. So we're going to have a group for autistic students to come together. We're going to have a parent group for parents of those autistic students. And these were youth who were at risk for depression. And we're going to actually focus on the teacher and on the whole school that those students are in. So they did those 3 things together at the same time, right? The idea is that overall, by doing all 3 of those things, they think that they're going to best improve belonging and connectedness, and help a person regulate their own emotions. And because of that, see an improved kind of mental health aspect. So this is the idea behind it. So I want to walk you through these 3 elements. First and foremost, talking about what did they do with that school, right? Or what are they doing with the schools and with the teachers? So this is a whole school focus. They did 2 main things, or in this plan, they do 2 main things. One is they develop what's called an index of inclusion. They convene a group of individuals together, of students, of staff, of advisors from outside of the school, to actually index that classroom and that school to say, how inclusive are we? Not specific to any one student, but what are our policies like? What are our practices like? How do we include people with differences within our environments? And they develop essentially a metric or an indicator of inclusion, and then they problem solve and they say, how can we move us up on this index? How can we improve? How can we become more inclusive for our whole school? And let's embark upon that. So there's no calling out any one individual. It's about figuring out together what can we do to make for a more kind of connected, belonging, inclusive environment. The other thing that they do in the school kind of situation is that they focus on teachers who are providing education to autistic students. And again, here it's not just about teaching Autism 101. This is about focusing on how can teachers enhance the connectedness within their classroom. What are the practices they could do to foster warm relationships for themselves with students, but also among students? How can they improve student belonging? How can they bring in equity and fairness to what's happening in their classroom for students with differences and disabilities and those without? And as well, interestingly enough, part of the intervention is about helping teachers manage their own stress. So going back to the importance of treating the context, not the person, this actually empowers teachers to manage their own stress better. And as well as kind of resources and strategies and kind of the brass tacks of what do you do? So people get it. So this is what they focus on for a whole school approach. They become more inclusive as a whole school, and every classroom is more warm and inviting and enhances this kind of belonging. It doesn't mean people don't struggle. It just means that we're kind of changing these kinds of ingredients. The second one is focusing on the parents. So what did they do here? They had a very brief I believe it was a 4-session kind of parent meetings where they bring parents together of autistic high school students, and they talk about ways that the families can enhance connectedness and promote regulation, emotional regulation for all the members of the family, not just for the autistic member or members. So again, not calling out any one person, but increasing that kind of connectedness. They talk about parents, along with what we've said already around mindfulness for parents, helping parents manage their own stress and their own emotions, as well as promoting regulation in their teens and the attachment or the relationship between the parents and the teens. So I'm giving this flavor to people so that they realize that it's not just about telling parents how their teens should be different. It's about telling parents and helping to empower parents to modify their family environments to be different. And lastly, there is a focus as well on the individual, where what they do for this one is they have smaller kind of group meetings among the autistic high school students, where they work on what they call resources, and bricks was their term. So these bricks were things that kind of create a foundation of resilience for the student. And you can see the kinds of activities that they try to cover among the kind of individual, these group environments. So they talk about and try to figure out people's personal strengths. They try to talk about perspective taking, about well-being, and empowering the person to be more resilient. But they don't do any one of these things. They're focused on all of these at the same time. And that's why this is such an interesting and important program and a map for us, I think. If we're going to have interventions here really to promote mental health, we can't just zoom in on this individual focus, because we're missing a major component of what it means to intervene. My takeaways, if nothing else, is this kind of slide. This is my wish list or my prescription pad, right? I don't write prescriptions as a psychologist, but if I did, this is what I would put on my prescription pad for people, right? There are individual changes like skills that we need, physical health, control. There are relational aspects, caregivers who are nurtured, non-stressful relationships, and there are broader aspects of safety and of belonging. So think in these reds, these grays, these blues, as you're thinking about caring for somebody or for yourself or for others, and we'll have a more mentally healthy kind of society as a result. So those are my main takeaways, Matt. I know that there are some pressing questions that you're kind of chomping to kind of ask me.
Well, you know what? I think that some of these questions, now that I'm reading them, I think these are going to be better suited to a response afterwards, if you don't mind. There's a few of them that are kind of, I think they're going to take us off and into another realm. I do have one quick one before I go to close. The study that you took us through just before, that's published? That is stuff that people can look at, like some of the tactics, or not tactics, but I guess the things that, okay, it is, yeah.
That's okay. Right. So this one's been published. And so if you have access to this, you can email the authors, of course, but you can, or you might have access to this. So the link is there. That's right. So this is out there in the public domain. To kind of, and it breaks down what I've talked about here in a lot more detail, than any one webinar could kind of provide. That's right.
Okay.
Right. And so, it's actually very exciting. There's some aspects that have been studied and shown to see change, and other ones that are at this point conceptual and they haven't actually shown yet. But the roadmap is there. The whole point of talking about this for people, and I would encourage people to read this or to contact the authors, is because if we just say, here's where we are, let's get to that end result of better kind of environments and better kind of functioning and better families, but we don't have a map of how to get there. It's almost like having Google Maps with two pins, but we don't actually see the routes we can take. Yeah. And there are many different routes that get us there. And we can choose which routes we take, but we need to see the routes. So this kind of publication, and what I was hoping to do today, was to show people the different routes, right? The different ways of getting from point A to point B.
Well, Jonathan, that was a great webinar, and I think that there is probably a lot of questions that have come out of this, and maybe a reason to come back either in studio or back this way to talk about it. For all of you, we are going to throw to a video at the end of this, and I'm going to let you throw to that. But for everyone who's online, a reminder: questions are going to be looked at, and Jonathan is committed to a FAQ blog post get back in some way, especially for those ones I had queued up that I didn't get to. This webinar will be available on demand later on today, by tomorrow for sure, on the Autism Ontario website. There's a webinar section there. There's also Connect with Us virtually, which is a great place for resources. And interestingly enough, as if this could become an index for webinars we've done over the past 12 months, where each topic that, Jonathan, that you spoke about, we've had people attack in a smaller webinar. So if you feel that there's one aspect that you need to dive in, you can find it there. You can reach out to Autism Ontario. They're always good about that. And also remember, if there's anyone in your family, friends, care circle, anything that you think would benefit from this webinar, please send them this link. It's going to be available on demand. You can watch it anytime. And the more people that we get through this program, the more of these programs we're able to put on. So with that, I will bid everyone adieu. Jonathan, can you tell us what this video is all about that we're going to throw to at the close?
Sure. So this is a video that people are going to see that I pulled off of YouTube. It's a news kind of feature, right?
Okay.
And you're going to watch a news feature here of a group kind of from Nevada featuring how of an autistic kind of youth's journey or experience of changing, of improving his mental health as a result of a combination of a whole host of things that I've covered today. If it's kind of an anecdote to really drive home the point of what it means to intervene. And it's not what you think in terms of interventions. But I want people, if they're watching this, to think to themselves, well, what are the parents doing here that's working so well? What's important about this school and this community that's working so well for this person? What about that goodness of fit between that person's interests and the opportunities in their environments, right? So think about those concepts as they watch it. It's not, no newsreel kind of video is going to be perfect, but it just kind of shines a light on some of those, or makes real some of those concepts that we've covered in the last hour.
Sounds good. Thanks so much, Jonathan, for your time. Thank everyone else for your time here. We look forward to seeing you on the next Autism Ontario webinar, and we're going to throw to that video right now.
Well, it is a common sight at high school games across the country. A student dressed up as the mascot working the crowd. But what Nevada's mascot has been able to do is anything but ordinary. Here's tonight's Sunday Sports Extra. On Friday nights, just about the only thing that attracts more attention than the camera guy is the mascot. And the Nevada Cub has the roll down pat. They love him.
It's okay.
Well, all right, not everybody. He spreads joy all night, but the biggest smile is happening inside the mask. And it belongs to senior Caleb Popejoy.
He's autistic. He has autism. He was antisocial. He had a hard time being in crowds of people.
I think it was when we started middle school. He was terrified just to walk into a big crowd in the gym when school started. A group like this would have scared him.
So you can imagine Mom and Dad's shock when Caleb had an idea his freshman year.
He seen the mask at the school office and took an interest in it.
I kept thinking about other mascots. I dressed up in them.
It was worrisome. We were there right by his side when he first did it because we thought he was going to be nervous.
Instead,
Coming out here and giving people high fives and giving them hugs.
Why you want to do it? Being the mascot has really brought out his social side. It's allowed him to express what he couldn't otherwise since he's behind the mask.
you got some moves down?
Yeah.
No doubt about it, the costume gave Caleb courage here in Nevada. But then a funny thing happened. When he took the costume off, he realized he didn't even need it.
He's gotten used to people now. He can greet people. He can talk to people. He's not afraid of crowds anymore.
I feel excited and happy.
Despite autism's social and emotional challenges, this cub has matured. Tell me how proud you are and how far he's been able to go.
Oh gosh.
Oh, the hard question.
Yeah.
To me, he seems like a new child.
Yeah.
He's not the same kid he was when he started high school.